What are the treatment options for your dog with a cruciate ligament injury? ACL tears are painful conditions. As the cruciate ligament is ruptured, the knee joint does abnormal movements and becomes unstable. Each time your dog stands and walks, the joint gets inflamed. It is painful and it limits your dog's ability to walk and being mobile. We will look at how to stabilize your dog knee joint, with surgery, or a knee brace. Then, we will review some ways to control the pain level while introducing therapeutic exercises to improve their mobility. How do you stabilize the knee joint? With surgery and internal implants, or with a dog knee brace with external support. Both are valid options for full or partial tear as long as stability is acquired. Please understand that with a cruciate injury, the ligament will never be repaired. Scar tissue will build up around the knee to stabilize the joint. Healing with stability will provide a snug, tight scar tissue. Whereas healing with abnormal joint motion will lead to arthritis and loose scar tissue around the knee. The scar tissue will take about 6 to 9 months to form properly, and to be strong enough to bear full activity, such as running and jumping. Let us look at braces and surgery as a mean of stabilization. The Balto Dog knee brace has 2 rigid splints inserted. One lateral, and one medial. At the beginning of the recovery, the brace is used with the splints to help to stabilize the knee while the body builds up a snug scar tissue. The brace is worn all day and removed at night. Later in the recovery period, the splints are removed, and the brace is used as a protection to prevent a flare-up. Usually, this period lasts another 6 months. The brace is only used when the dog is overactive and risked to tear the scar tissue. There are many types of knee surgeries to repair an ACL because none of them are perfect. Tie rope is a surgery that is extracapsular. It aims at replacing the cruciate ligament but placed outside the joint. Among surgeries, it is one of the less invasive. However, there is a high rate of failure, rope break, and infection of the implant. It is recommended for dogs less than 20 kilograms. TPLO, TTA, TTO, are more invasive. It implies sawing the tibial bone to change the angle of the tibia plateau, and to stabilize the joint. It is more painful, and it takes longer for bones to heal. The results depend a lot on your surgeon's skills as well. Please trust your surgeon as they are used to perform one type of surgery, and does it well. How to choose between surgery or a knee brace? There are many factors specific to your dog and how you wish to manage the recovery. You choose a knee brace for many reasons. First, when surgery is not an option, or when you are waiting for the surgery to be scheduled. Some factors are more in favor of conservative treatment with a brace, and others more in favor of surgery. Many risks are associated with surgery and not everyone are ready to go through it. The cost is a big issue. Particularly when you learn that most dogs who develop one ACL in their life are likely to develop the second knee as well in the following months or years. The risk related to anesthesia is another one. Many dogs with a heart condition, kidney failure, or liver disease are at high risk of dying during this long surgery. There is also the risk of infection post-surgery, and the risk of failure of the implant. Some dogs are really anxious at vet hospitals. Pets' owners are not always ready to take them through an invasive, painful procedure requiring cutting bones. If you choose the surgery, the procedure may be scheduled weeks later. In some places, veterinary surgeon specialists are not available for weeks. While waiting, using a brace will allow them to walk and maintain their muscle mass. In addition, some surgeons will delay the surgery if your dog is overweight. Pet owners are advised to put their dog on a diet first. However, the dog should also be kept in a cage to minimize the damage on the knee when walking. It makes losing weight even more difficult with no exercise. Supporting the knee joint with a brace would help the dog going back to walking, and help to lose weight. Similarly, if you need a few weeks, or month to save up for the cost of the surgery, it would make sense to use a knee brace during that period. This way you can still walk your dog and decrease the amount of muscle wastage. We can now look at some of the factors in favor of conservative treatment with a brace. The logic behind is to understand what are the elements that would increase or decrease the probability to damage the joint. Weight is a huge factor. Heavy breeds put more weight on their leg. The joint does more abnormal movements, therefore more damage to the joint. Without surgery, small breeds tend to recover more easily than giant breeds. Another one is the level of activity. Again, it makes sense that overactive dogs are more likely to tear their scar tissue. They put more forces inside the joint and create more damage. As a result, placid dogs are less likely to relapse and heal faster than young active ones. Finally, if arthritis is already present inside the knee joint, then with or without surgery, the dog is unlikely to recover 100%. It usually remains a weakness for life. Ask yourself, did your dog already has arthritis before the injury? Also, when did the ACL injury occurs? A few days ago? A few months ago? Arthritis post-rupture of the cruciate ligament occurs as early as a few months later. In contrast, when do you choose a knee surgery? A first way to look at it is to choose the surgery option, when a knee brace is not an option. For example, braces require a daily routine to fit it on your dog. It may not be a good option for pet owners with sore backs and arthritic hands, who would have difficulty handling their dog, and fit the brace at the same time. Surgery is convenient. Implants would stabilize the joint, days and nights, without the pet owner getting involved. Some dog behaviors would make the brace option quite difficult as well. For example, when dogs dislike wearing braces, or bandages, and bite them. Finally, braces may not fit all dog conformations. Imagine a dog with amputation of one of their back leg, or a dog with neurological conditions like dragging toes. Braces may not fit perfectly with these specific conformations. Now, what factors point toward surgery? It is mainly when additional injuries are present on top of the cruciate injury. One of the advantages of the surgery is to access the joint. It is then possible to visualize, and to repair other additional injuries, such as meniscus tear, kneecap dislocation, and damage on the collateral ligaments. To sum up, the Balto knee brace can be used as an alternative to surgery for a full and partial ACL tear. They can be used on one side or assembled in a dual position to support both legs. The Balto brace is also useful post-surgery with overactive dogs, or months later if arthritis is forming. In addition, it is a good idea to support the arthritic knee of senior dogs. The next factor influencing healing is how much exercise your dog can do at each step of the recovery without hurting themselves. Here are some examples. Please remember that it is recommended to exercise only when the knee is stable. Ideally, a canine rehabilitation practitioner would design a specific program for your dog. The main idea is to be progressive. The aim of the first few months is to control pain and for your dog to learn to trust their leg again. In the second phase of the recovery, you can expect to build up strength and muscles. Then in the late phase, the brace is used less and less, only as a protection, and return to full activity. In the first month, your motto should be minimal activity and maximal control. Common therapeutic exercises include slow walks, hydrotherapy, and weight shift exercises. Slow your pace. To follow you or their motivations, dogs rather run on 3 legs than walk on 4. Give them the time to drop their leg on the ground by walking slowly, on flat ground, and straight lines. Add a lead to control the speed and direction during the exercise. Many people associate hydrotherapy with swimming to build up muscles. However, swimming is a fast activity for a freshly injured joint. A first step would be to walk into shallow water. Water makes weight bearing easier. Dogs are then keener on using their injured leg and build up trust. Sometimes, dogs have been walking on 3 legs for weeks or months. It becomes difficult to change that habit. Weight shift exercises are great to teach them. The idea is to rock gently right to left many times to shift the body weight on their injured leg. Let your dog realizes that their leg is not hurting anymore when they are wearing the brace. Let them gain trust. Another trick would be to gently lift the contralateral leg for a second to shift their weight, then let it go, and repeat a few times. There are many other examples. Just ask your rehabilitation practitioner. Usually, after a month or two, your dog walks more comfortably. The scar tissue around the knee is present but not strong enough for intense activities. It is time to remove the splints from the brace, and to wear it as a protection to prevent a flare-up. This is a critical period of high risk for relapse, as you increase the amount and intensity of exercises. One example to build up strength is to climb stairs, and to go back on tracks. Go for longer walks and try to include up and down hills paths. Hydrotherapy is another one. This time swimming. Swimming is a great exercise to build up muscles, and regain strength. Remember to remove the brace for this exercise. And be careful if your dog has arthritis to not swim for too long, or you may trigger some inflammation. You can also start to increases the forces on the knee joint, and add lateral tensions as well. Progressively, allow trotting period for longer. You can also lead your dog to perform large turns, such as a large circle or a figure of 8. The aim of the recovery is to return to full activity, jumping, running, performing sharp turns. At that stage, the brace is worn without the splints, only as a protection when needed. During a day out at the beach, or playtime at the dog park for examples. Keep in mind that some dogs with arthritis in the joint may never recover 100%. The knee brace without the splints become very useful for the rest of their active life. Everything we mentioned before about surgeries, braces and therapeutic exercises should always include pain management. Without good pain control, then the recovery will last longer. It would take more time for your dog to regain the trust of their injured leg. Your veterinarian will have many drugs available, but you can also add joint supplements in your dog food, massage their sore muscles, and join a program with Class 4 laser therapy. The most common veterinary drugs are anti-inflammatory, opioids, and Cartrophin monthly injections. The most common joint supplements are green lips mussels, glucosamine, chondroitin, and omega-3. You can find them at your vet, or sometimes they are included in pet food for senior dogs. Typically, with an ACL tear, dogs would hold their leg up. The muscles above the knee become sore. Then dogs shift their weight on the other leg. Their back muscles start to compensate and get sore. In turn, muscles near the neck and in between shoulder often compensate as well for the sore back. In conclusion, your dog would greatly benefit from a daily, 5 minutes massage along their back and back legs. The photobiomodulation effect from laser therapy is really helpful too. As it increases blood flow, decreases pain and inflammation, it is a great tool for pain management of senior dogs with arthritis, and among rehabilitation programs to heal faster. Home equipment Class 3B lasers and LED are available from many online shops and eBay. But Class 4 laser therapy are more powerful and efficient. It requires training and is accessible to veterinarians and health practitioners only. Most vets would have price packages available, just ask your veterinarian about it. Thank you for listening, and don't forget to click on our website alphamobility.com or our Facebook page to learn more about the Balto Dog Knee Brace.